This episode of HIPcast is brought to you by Enterprise Social Record, the only closed-loop referral solution for social determinants of health needs built with health information expertise. ESR allows clients to assess, refer, report, and trend the SDOH needs of people in their care. Report quality metrics like HEDIS and MIPS. ESR provides real-time CBO engagement in community-specific ecosystems with Z-coding and engagement in an anti-fraud framework. For more information, visit www.enterprisesr.com. And welcome to our episode today about health information, the health information profession. How in the world did we get here? And we are excited to have two incredible guests here with us, Miss Wanda McKnight and Miss Claire Dixon-Lee. I'm going to introduce Wanda, and then Shannon's going to take on the introduction of Miss Claire, and then we're going to get rolling because we got a lot of history to cover here in this episode. So I did
95 years, right? 95 years worth.
That's right. We should have saved this episode for 5 years down the road, done the Centennial podcast. I do have a bio here of Miss Wanda that I will read, but I did enjoy in our preparation for this, Miss Wanda sent a resume that had been, it appeared to be typed up on a typewriter, which was fantastic. So got to show my wife and my kids that, and they had a good kick out of it. But Wanda McKnight started her career in health information management as an accredited records technician in 1977, as supervisor of coding and abstracting at Metropolitan Nashville General Hospital there in Nashville, Tennessee. Future positions included quality assurance coordinator, surgical data analyst, and office manager. She became involved in the then Tennessee Medical Record Association, serving in various volunteer roles, including president in 1987. I won't tell you what year I was born, Miss Wanda. I'm sorry.
Please don't.
In 1988, she accepted the position of executive director of the association, now the Tennessee Health Information Management Association. She expanded her role in association management, becoming the chapter administrator for the Tennessee chapter of the American College of Surgeons in 1990. And she was elected to the American Health Information Management Association Board of Directors in 1992 and in 1994. She founded Seminars, Training, and Association Resources, Inc., an association management company. She attained the Certified Association Executive Credential in 2013. And in 2016, she co-founded Synergistic Management, an association management company that specializes in chapters of the American College of Surgeons. She left the company in March 2023 and continues in her role with THIMA and the TNACS. So welcome, Miss Wanda. Shannon?
Yeah, absolutely. And Dr. Claire Dixon-Lee, before I start with your bio, I should have done this, but being from Tennessee, I need you to pronounce for me. Is it Damon College?
It is. David
Okay,
College, yeah.
Perfect. I got it right, even being from East Tennessee. I'm so proud of us. I'm making us look good already, Seth. So go us.
It's exciting.
So I know. Dr. Claire Dixon-Lee is a PhD, a registered health information administrator, CPH, and a fellow of AHIMA. She began her career in Buffalo, New York, in practice as the director of medical records for Buffalo Psychiatric Center. Later as faculty at Damon College, moving to Chicago to work for AHIMA, which was then AMRA, in the academic and continuing education divisions, where under her leadership, the very first Assembly on Education, or AOE, Summer Symposium was launched in 1989. She had a long career in higher education as a program director and associate professor in health information management and in public health informatics, undergraduate and graduate programs. Dr. Dixon-Lee holds a bachelor's degree in medical records administration or health information management from Rosary Hill College. Now it is Damon College, a master's degree in epidemiology from SUNY at Buffalo, and a doctoral degree in public health policy and administration from the University of Illinois Chicago School of Public Health. Dr. Dixon-Lee was selected as the very first recipient of the Alexander M. Schmidt Endowed Fellowship in Technology and Clinical Practice Assessment of the University Health Systems Consortium. That was in 1993. She received the AHIMA Triumph Award for Professional Achievement in 1996. And the most recent Distinguished Member 2023 and is past president of AHIMA from 1999. She is a former president of MC Strategies, Inc., which is a web-based learning management corporation, and recently owner of CDL Strategies, LLC Consulting. She's worked for some of the industry's significant healthcare technology companies in product design, encoder technology, and information systems development. Dr. Dixon-Lee holds a DHHS appointment with the Agency of Healthcare Research and Quality, or I think we call that ARC, from 2011 to 2017. And she was the first CEO of CAHIM, which is the Commission on Accreditation for Health Informatics and Information Management Education. That was from 2003 to 2016. And she has been, obviously, by her resume, a lifelong volunteer, most recently as a public board member for the Council on Accreditation of Nurse Anesthesia Educational Programs, and newly elected public member of the National Architectural Accrediting Board, NAAB. She continues to serve as a peer reviewer for CAHIM graduate degree programs, and Dr. Dixon-Lee demonstrates a tradition of facilitating inspiration and fresh ideas to newcomers and to established members of health information management and health informatics professions. Welcome, Dr. Dixon-Lee.
Thank you.
I'm a little intimidated, Shannon.
I know. I was like, my CV looks like nothing. You know.
Oh, my
goodness.
Lord, you get to know her for your different jobs. So.
Don't very good. I know.
Yes.
Yeah, it's great. I'm so excited. So today being our first official episode of the podcast, so we've had an intro podcast, which was a little shorter, just Seth and I kind of talking about why we decided to do this. This will be our first episode of our podcast to kind of level set. What is health information? How did this profession get started? How old are we? I think we are moving into our 96th year now. And then kind of what is the now of health information and the profession, and then also kind of what do we think about the future. It's going to be a really fascinating. I'm going to learn a lot about the history that I don't know. Even though I'm a tenured professional, I'm not quite as tenured as the guest on the show today. Yeah,
that's right. It's going to be a whirlwind of information, I hope. And but yeah. I don't think we can throw out there that Wanda nor Claire have been here in the full 95-year history, but an understanding of the full history is probably fairly close.
Very good. Yeah. So Claire and Wanda, I'll let either of you answer this that you want. So how did we become a profession? How did American medical records or American health information get started? And kind of how have we morphed through the years as both a profession and as an organization?
Well, I guess I'll take the first pass at this. And while I wasn't there in 1928, as you probably remember in your history, Grace Whiting-Myers and her colleagues, of course, started the association. They wanted to get together and they wanted to improve documentation. And I think you all probably know some of the history again from your classwork. But the American Hospital Association really did a service to our profession by emphasizing the need for better documentation. And I guess I can go back to I joined. I joined in 1970 when I was a student at Rosary Hill. And in fact, my number is still 9,008. So there were 9,000 members. I was 9,008 in 1970. Wow. I graduated in 1971, and at that point in time, we were still registered record librarians, RRL. And my very first certificate was an RRL. My mother bought a pin for me AMRA at the time used to sell these little pins that would show the initials, and she bought the RRL. I may have it somewhere, I don't know. But anyway, within a year, in 71, the latter part of 71, it was voted to change the name to Registered Record Administrator, and that's what we stayed for a long time. And that made sense. Again, we were not really librarians; we were administrators. We were doing a different type of work, but still a focus on patient documentation, patient record. In 1991, just the year before Wanda was on the board, 1991, the association changed its name to AHIMA and AHIMA, and that was a big to-do because some of us folks wanted to continue to say the name American Health Information Management Association, but then we were taught to say AHIMA, and we didn't like that.
I find it a shock that we didn't all agree on everything
right.
as HIM professionals.
Because today we all agree completely, right?
Yeah, everything's just very easy.
We say AHIMA now. We, us old-timers, didn't want to, but we came around. And then again, the year I was president, that was the year that, as the board, we decided to change our name from our own credentials to from RRA and ART to RHIA and RHIT, Health Information. So it was probably at that point that health information in the 90s when we really realized we were a broader perspective. I think the other point to your question, and then I'll turn it over to Wanda, is what makes a profession, so to speak. And again, going back to history, I think it was around 1938, when the colleagues that had formed that association got together and developed a curriculum. They decided, in those days, these programs were taught in hospitals. And by I think it was around 1943, they decided that they wanted to begin to recognize programs, and they did it through the American Medical Association to accredit. So accreditation began. And as long as I've been in this field of accreditation, which has sort of been my final stage of working, accreditation does really forms a discipline, because you have a curriculum, you have standards around it, and you have somebody looking at it to see that your outcomes, the graduates, are reflecting the field and the talents and skills that are necessary. So I think that's really when this profession became solidified. After a while, AHIMA eventually worked on accreditation with a group called KHIP, and they were accrediting allied health programs. So we were part of the allied health group. And then when I came on board in 2003, it was decided by the House of Delegates that we should do our own, that we weren't quite allied health. We were verging on technology. We were still healthcare. We were many faceted. And that's when we formed KHIM, and I guess the rest is history. And you are part of history, Seth and Shannon, because you're graduates of programs from the KHIM vintage. So I'll turn it over to Wanda to fill in with her history.
Okay. Thanks, Claire. I'll step back in time just a tad to tell you that the Tennessee Association, Tennessee Medical Record Association, was formed in 1950 with 33 members in Knoxville. And the inaugural event was at St. Mary's Hospital in Knoxville.
Really? I did not know that.
That's awesome.
That was my
I
first.
didn't know that either.
That's where I worked for the first hospital job, was at St. Mary's.
St. Mary's. So,
that's wild.
Awesome.
Yes. I actually have a picture from 1951.
Wow.
And this may have, I suppose this was a special dinner because, of course, it's all women sitting around these long tables, and they are dressed to the nines.
Right.
Most have hats on.
Oh, gosh.
They have
great.
Really impressive looking programs sitting on the table. And then there are a few nuns scattered here and there, you know, and but no men, of course, and no people of color, of course. Those were those times were like that. But that's how the Tennessee Association started. And then, of course, it expanded across the state. And I'm sure that the 33 members present in Knoxville were not all from Knoxville. There had to be people coming from other places. In fact, I think I could recognize a couple of the people. But believe it or not, they were young at that time.
Yeah.
But as the community expanded and across the state, we became connected with the Tennessee Hospital Association, much like Amber had done. And the Tennessee Hospital Association had a program where they supported allied groups like ours. So they would serve as a central office for a number of years. And we actually patterned our organization after theirs. And that's how we developed our local associations. They were patterned directly after the hospital districts. So we still have that structure, for which I'm very thankful, because I think it really holds our association together. And I do appreciate Claire's comments about how we became a profession, because when I came into the workforce in 1977, I had been to a school where I learned, I thought I was ready to tackle the world, and I knew everything there was to know about medical record technology. And then I find myself landed in the General Hospital, which is a safety net, inner city hospital in Nashville. Mm-hmm. And I realized quickly that I had a great deal to learn. But I wouldn't trade that experience for anything, because I made some lifelong friends there. But equal to that, every manager and the director of the department, we all had to know how to do everything within that department. And I mean everything. Nothing was siloed. Nothing was outsourced. We had minimal resources. So we joke and say, if you could be good there, you could be good anywhere. Yeah. And it was a very valuable, precious experience that I share with many people from those
That
days.
has to be where I remember as a student, I was always told that the Health Information Management Department's the hub of the wheel, because we kind of have our hands in everything. We know everything. I assume that came from those times to where you didn't have outsourced companies. You didn't have vendors that you could send this to. You just had to do everything you could with what you had at that point, right?
Exactly. And try to do it in a way that didn't bring the entire medical staff screaming and yelling into the department at everyone or the administrator. But at the General Hospital, it was usually the physicians who didn't get the record they wanted or something like that. They happened to be right down the hall from the department. So there were a few I was completely frightened of, I'll be honest to tell you that.
Yeah. I have a little bit of a follow-up question, just a funny probably. But I'm thinking now, Seth, maybe we should have titled this particular episode "Coming Out of the Basement." Maybe that's what we should call this episode. But I wonder, Claire and Wanda, do you remember the staff smoking in the medical records department?
Yes,
absolutely.
I thought so. People used to actually smoke in the hospital in the medical records department.
In fact, I have a photograph of my staff at the psych center smoking, and even at the university as late as when was I at U of I? I guess it was in the 80s, late 80s. And I remember we had one faculty member who smoked, and I had to buy, everybody was complaining, but she wouldn't stop. So I bought an air filter machine for her office and kept her door closed. Wow. And everyone was having a fit about it. But yes, smoking was one of the things. And I was just going to tag on with what Wanda said. We had the only Xerox copier in the entire psych hospital. So everyone would come in and want to use the Xerox. And then we had to clean it. There was like a drum, and you had to wipe it off once every or something, and put the toner in, and nobody wanted to do it, so I usually wound up doing it as a director later on in the evening. So anyway,
and that was the only one in the entire facility.
It was the only one. Yeah. Wow. And it was Buffalo Psychiatric Center. Just a side anecdote, it is now the building was a classic building designed at the turn of the century, the late 1800s, and the old building. And my office was on the main floor, just to the right of the door going in. It is now a hotel. It's called the Richardson Hotel.
Oh, wow.
The main building. And my office is the bar. So
How appropriate.
it's still
It
a hub.
was and is the bar.
That's right.
Well, that's interesting, Claire, because the general hospital, much of the general hospital is now condominiums.
Oh, yeah.
Yeah. Have you checked out to see if your old office is now the bar in those condos?
At the condo, yeah.
Yeah.
No, but if I found out that it was, I'd go for a visit.
That's pretty fantastic. It's fascinating to see, because I know St. Mary's is no longer there. It's been torn down, and which is interesting to see. And you're talking about the trends, some of the changing trends of health information. I remember when I first went to work at St. Mary's, we still had the embosser cards, and we had to emboss all of the medical record documents. And I remember when we shifted to using labels. I assume we'll have some students listening to this that all this is foreign to them, but those were fun days to emboss all the medical record documents with the patient information on them.
Yeah, I wonder, Claire, do students today learn anything about terminal digit filing?
It's a good question. I think they, I know when I was still teaching, I did run them through, and it was probably a quick lesson that they did on their own. I'm guessing that they are doing some quick lesson on it. I would think, because I don't know, but I'm guessing that there still are some facilities, maybe physician offices, whatever, that are still using paper records. I know I laugh because the eye physician that we go to here in Florida, Coastal Eye, they still have paper records. And when we see people, carrying these huge volumes, they are switching to an electronic system, but they still have paper records all over the place. So, and it looks like they are in terminal digits. So I'm guessing that
those were the good days when you had the sticker rolls, and when you break open a brand new package of chart backs, and that smell was so good. And
yes.
You talk about those times and the benefiting from the community. Wanda, how does the health information profession benefit from our state associations, our local associations, our national associations, as well as the community, just all of the health information professionals around?
Yeah.
Well, I can't be objective in answer this question because the state association is, near and dear to my heart. But I would just say, Seth, in so many ways, when you really think about it, the association almost serves as a framework on which the profession rests. Because the profession, otherwise, how would professionals connect? And how would they develop relationships, except within their own small communities, especially before we were so connected, virtually. So I really have a lot of respect and regard for the institution of associations, and particularly ours, of course. But, it provides a way for professionals to share, best practices, to share worst practices, to talk about their failures, to talk about their successes, to learn from each other. And really importantly, I think it provides a way as a profession, for us to support and grow the next generation of health information professionals through our student connections, student scholarships, and that sort of thing. And that's incredibly important for a profession, in my view, to have a focused effort to support and grow, the next generation. So I can't say enough about the importance of an association. And even now, when things are virtual, and I can have as close a relationship with just about, I suppose, as the people in Kentucky as I do in Tennessee, because we're all connected this way. But we do that ability to communicate that way enables us to go even a step further in meeting our members' needs. We get lots of questions from members about, really down in the weeds things about regulation, release of information, and coding guidelines. And we're blessed with a team of volunteers in Tennessee who, respond to those questions. There was a time, believe it or not, when I could answer a lot of them, but as time has gone on and things have changed, I have to rely on the people who really know to answer the questions. But and before I pass it over to Claire, I will just say this too. One other huge important benefit to me has been the opportunity to develop really solid lifelong friendships through a connected work, and the purpose that we all share. It brought us together, and then in many cases we've been blessed to have just really wonderful friendships. And we know, even though we can all work from home and never see another human body face to face, we know from the wisdom of the ancients, from all the way from King Solomon to two are better than one, to John Donne with no man is an island, to what we've learned through COVID. We're better together.
Yeah.
We're just better together. So I think that our association, the state, and also at the national level for many years, I don't know if it's that way now so much, that I think we provide or strive to provide a fertile ground for growing friendships. And it's certainly been that way for me. But just one last comment before I pass it. I'm not sure what the future is going to hold with that sort of a community that we share, because there are always changes, and lots of changes are wonderful. So I think it's something we really have to focus on, and we have to work to fight and keep what's precious to us. So
be intentional about that and developing those relationships.
Right.
It's critical. It was critical for my development as a young professional of having those friends and those peers, the mentors throughout the association that I could call and say, I'm a night shift supervisor in medical records department and I don't know what I'm doing. I need help. And I had those people that I could call.
Yeah.
That's equally critical for an old professional, Seth. So not even just for young, because our industry changes constantly and we can't possibly know all the things. So even young professionals, so maybe a note to students and new to the profession folks, it's not, you're not alone in not knowing everything. Like none of us know everything. And even if we were super skilled and we could do terminal digit filing with our eyes closed and we knew which physician was going to not get his stuff completed and we were going to have to threaten to suspend him. Like even if we knew all that, now we don't know everything because their information is created in so many different places in our industry. So for new professionals, students, and for seasoned professionals, we have to have this network to be better and to do a good job for patients, right? And for our members. Claire, anything to add?
Yeah, I would say I was just thinking back to my career and, growing up in Buffalo, New York. For me, the first, while I belonged to AMRA, belonged to the National Association, it was my local association that I got directly involved in as a student, then a new grad. I went to work in the hospital right after the day after graduation, in fact. So I needed that network of colleagues to help me with, what should I do that first week, that first month in my new job. So I got very active in the local association, and that really saved me, I think, to move forward. And then it, branched into our state meetings that we'd attend, and then finally, of course, moving to Chicago and seeing AHIMA firsthand. I think it's interesting too that AHIMA itself has gone through, I don't know, every few decades or whatever, it reinvents itself. From the beginning, its name changed several times. The focus changes, leadership changes, new things evolve, some things come back again. It is an association, and it's always been my professional home. But then again, I've had so many other jobs and directions in my life that I have joined other associations too. And even now, I think I still have 4 memberships, AHIMA and 3 others. And I do that to keep current in these other areas. But I would still say my professional home is where I began. and that is AHIMA. So, and that's a struggle. That's something AHIMA has to, the association also has to realize how to, and every association on a national level does.
Sure.
How do we attract new people? Again, I've got to know the nurse anesthetists. I'm now learning about the architects. Same issue. Their professional associations too are trying to get membership, encourage students, graduates to join. So it's a continual challenge that I think we all play a role in that.
Yeah, I agree. We've been really fortunate in Tennessee to have Wanda leading us for many, many years and just be our guiding light and keep us up to date on things we would not have known about if she weren't connected and paying attention to things at the national level, from a policy standpoint, from an association standpoint, from just a profession standpoint. So we've been super fortunate. And another thing about Tennessee is I don't think all component associations do this for different reasons, but we do strategic planning every year. And that is an in-person event where the executive board and sometimes the local board from the different local associations come together, and we work to align our strategic plan with the HEMA's as best we can. But the beauty and the magic of that being in person together to do that strategic planning, it's incredible because you're right, it is a breeding ground for lifelong friendships, but it's also a place where really innovative and incredible conversations unfold so that you can problem solve together, because 2 is better than 1, 3 is better than 2, like until you get to like 16, and then maybe it's sometimes too many. But the evolution of our profession and our industry, and then just technology, has changed a lot of things about how we work. And I love it. I love that it increases efficiency and it increases the opportunity to connect virtually. So I can connect with professionals in other states that I would never connect with were it for the absence of technology. But it also shouldn't replace, like we really do, Seth, have to be intentional. Just like you said, we have to be intentional about staying connected. But with all of those, the history, the evolutions, and then just the changes in the way we do work today, the differences in maybe how our national organization functions versus our state organization. What does the future of health information look like to you all? What do you think about the future of health information and the professionals that are making up this industry? It's a loaded question.
I can just say from personal experience, we still struggle with interoperability, the connectivity. And, I'm a retired person. I have 7 patient portals. And
wow.
in fact, I have a list, and none of them are connected because they're all different specialists. 2 different hospitals that I've gone to for different reasons, where I get labs done. I have a portal with the eye specialist, whatever. I'm still the connector. To my primary, I can upload, and she's very good about looking at my messages, but I can upload documents for some of the labs or whatever that I get from one of the other specialists, and appraise her every so often of, anything that's going on in my healthcare, but I'm still the connector. We have not solved that issue of interconnectivity, and I know we talk about it. There's vendors, there are the designs of systems, the healthcare facilities. They want to, work with their body of patients, consumers. They have specialties of their own, but then we go to other specialists, and you're still the connecting point. And if you're not aware of that, information drops off. And I think that's the issue with the continuity of care that we've always been talking about. So for me, one of those big issues for the future is can we ever resolve this interconnectivity and the sharing of information? Of course, we have databases now. We have lots of information, but we saw with public health and COVID, what a black hole right now with public health data. And again, even, I don't know, we've had COVID. I didn't report it to the public health agency. I did report it to my doctor. She probably maybe she filed something, but I don't know. So all of the data, those statistics, we know, how real are they?
Yeah.
We know they're just these are some of the issues that I still concern myself about and don't have solutions for. And I read some of the articles, the research that's going on, but it's all done in pockets, and they've still not achieved the level on a national scale to really make use of all of this data.
And if it's that difficult for us as health information professionals, imagine the general patient that doesn't know all the ins and outs that we know of how this should work.
That's right.
Wanda, what do you think about the future?
Well, I'm an eternal optimist, so I think the future is bright. I agree completely with Claire's point. And one common theme, if you really think about it at the most granular level, the one common theme for our profession from beginning till now is the data. It's all about the data.
Yes.
No matter what you've done. Claire and I were chatting about this before, and all the things she's done and the things I've done. It's always been centered around the data.
Yep.
And so that to me is the hub, as you say, Seth. And so I think AI is a game changer. I think artificial intelligence is rocking our world before we know it's rocking our world. I was on a call with other CA leaders the other day, and people were saying, well, their facilities had decided not to use AI, and I'm kind of saying to myself, oh, they are. You just don't know it.
Yeah, exactly. That's the truth.
That's what I believe. So I think that we have an opportunity because that situation. I mean, it screams for data governance, doesn't it?
Mm-hmm.
Yeah, absolutely.
So I hope that's an opportunity I hope we don't walk away from. That plus the interoperability issue to me are the two big things, challenges for us. And like I say, I hope we can rise to the occasion. I think decisions made at the national level from an association standpoint have a really dramatic impact on how we function at the state and local level. And I have real concerns about things that are happening nationally that may make it really difficult for us to function as a small business association. So I think that's one of the things that it keeps me up a little bit at night. But here's what I do know: the future is really kind of up to the HR profession, because
it's really valid.
We can. And not the people in my generation, but the people in your generation, Seth and Shannon. And I mean, it's going to be up to you to create whatever it needs to be to stay true to our values and our devotion to quality data. And I'm an institutionalist, so I think that associations really matter and support that effort. So I think there's something to be intentional about as well. But I think this podcast and other efforts like this will go a long way to, encouraging people and opening people's eyes to the opportunities that are in front of us. And, it's time to dig down deep and create the future.
No pressure, Seth. No pressure.
Yeah, exactly.
We're in good hands.
I want to add to that. I'd be remiss if I didn't mention higher education, just education
Absolutely.
in general. Educating at the associate degree level all the way up to doctoral. And I think it's a real challenge for faculty at this point in time. It's still a challenge to attract students to the programs in health information. But and to keep current and to have now with AI, and I've been reading recently and listening to some of the folks talk about the need for AI for our students, access to it. How can they actually effectively get trained? That was an issue with electronic health records. Now it's with AI, and how those applications are playing out in our healthcare delivery. So there's still some real challenges for our health information programs, finding ways to maybe cross-pollinate or interact with other disciplines on campus. and again, still attracting students to the field. So graduates, practicums, finding practicum sites, that's again, that's in almost every healthcare field, and find appropriate practicum sites where they will take students so that you really can experience some of the challenges that you'll face. So again, I'm happy to see that we have more programs than we've ever had, but there are still challenges that are being faced by our educators to keep going.
One last thought for me, Seth, before I hand it over for closing. 100% agree with you, Dr. Dixon-Lee. Lifelong education is important, whether it's formal or informal. You have to consistently keep learning what is happening. There's a lot of discussion around AI in terms of governance, but that governance that's being spoken about now is about how AI code is built so that things are generated, or about what's safe in terms of what's being built. But nobody's really talking about governing that AI generated document. How do you govern that from a health information output perspective? And that's us. Like that is who we are. That is our job, right? So thinking about lifelong education, being formal or not formal, and having the network, in my opinion, of professionals that don't know what you know. They know something way different, and you need them because they have to help inform you of the right courses to take. So this has been fascinating. I have learned a lot. I knew I would. I love this episode. This is so much fun. Thank you both for coming and for just sharing your years of knowledge. I also, being an optimist, believe, Wanda, you are so right that the health information profession is up to us as the people actively working in today's space in health information, which lives everywhere that health information is generated. It is not within the basement of a hospital. It is in so many different places. And so we should be in all of these places where that documentation is created, where it's stored, how it's exchanged and released. We have to be in all those places. So I also think that the future is exciting, even if I don't always agree with the direction of our national kind of footprint. I still believe the profession has an incredibly bright and awesome future. And then Seth and I recently learned that health information is a STEM education. That's only been happening for a few years. And I was so excited to understand we have been designated STEM. And I think that's very appropriate. So, Seth, I'll hand it over to you for final thoughts.
All right. Well, I absolutely agree with everything that you closed with there, Shannon. And thank you, Miss Wanda and Miss Claire, for joining us today. And I do want to thank our sponsor as well of this episode. Enterprise Social Record is the only closed-loop referral solution for social determinants of health needs built with health information expertise. ESR allows clients to assess, refer, report, and trend the SDOH needs of the people in their care. Report quality metrics like HEDIS and MIPS. ESR provides real-time CBO engagement in community-specific ecosystems with Z-coding and engagement in an anti-fraud framework. For more information, visit www.enterprisesr.com. Shannon, talk to you soon.
See you next time.